Hey guys, so today I'm going to do another video about what a typical day as a midwife is like, and today I'm specifically going to talk about what newborn care or special care nursery is like. So I've recently rotated here and I'm absolutely loving it, so I think it's a great opportunity to share with you guys some insights of what it might be like to work in a nursery type environment, whether it be on placement or as a career. So before I start explaining what we do, I reference it with the fact that I do work at a lower level hospital. It's not a tertiary hospital or a referral hospital or anything like that. So the cases that we do take are particular to this hospital. Of course, circumstances do happen and we do have sick and high risk babies at times, but generally they're transferred out. So the type of babies we might see in our nursery most commonly is premature babies that are growing up. So our nursery takes from about 32 to 34 weeks, and they generally stay to their corrected age of 36 to 40 weeks, depending on how they're feeding and how their parents are going with looking after them. Other common things we might see are babies with jaundice who require phototherapy, babies who might have lost too much weight in the first 3 to 4 days of life. What's becoming more increasingly common is babies to diabetic mothers. So if those mothers have gestational diabetes and they are on insulin, that can have an effect on baby trying to adapt their sugar levels. So we do see a lot of babies like that as well. Another thing that is a bit unusual but that I have been seeing a lot lately is some babies with genetic issues. So they can be things from heart conditions to chromosomal issues, and generally with that we need to consult and refer, and generally baby has to be transferred out. What some people might think when they think of special care is NICU, which is neonatal intensive care unit. We do not have that at our hospital, but tertiary hospitals do have that, and I have had some small experiences in the NICU, but that's generally one-to-one care, and they're those really premature or really sick babies. So I want to describe what a typical day might look like for me in the nursery. So where I am and what I've seen in most nurseries is a patient load model of care where you have from 1 to sometimes 5 babies to look after. So what a typical day would look like is scheduled feeds. So babies are on 1 hourly, 2 hourly, 3 hourly, 4 hourly feeds depending where they're at. So it's making sure you're staying on time with those feeds. Now with these feeds, they can be bottle feeds, they can be breast feeds, or they can be feeds through a nasal gastric tube. So what we also learn is how to put in and remove those tubes, and also how to feed babies. So what this does involve is aspirating the stomach acid from the baby to ensure the tube is in the right place before you feed. You also sometimes give medications through the tube. So some babies are on express breast milk, which is great, but unfortunately some of these babies are really sick and do need to feed, so they are on infant formula or like a milk fortifier or formula that has more calories, especially for these premature babies under 2 kilos to help them grow up. Other things that we do, and some of my favorite things, are bathing babies or teaching parents how to bath their babies, or just doing general cares, so changing the nappies, doing the baby's observations. Sometimes babies just need a little cuddle and I'm always the first to put my hand up. Love to sit there and just comfort babies. We also do give medication, and that can be very stressful at first, but once you learn that you should be following all the policies and procedures, you're always double checking, you realize that it is quite a safe environment to do it in. So this can be as simple as giving vitamin D, which can be given as drops in the mouth, through the nasal gastric tube, through baby sucking it, through like a teat. So many different ways, but this can also range to having to give IV antibiotics for things like GBS or Group B strep, or even running a glucose infusion for those babies of diabetic mothers. Another big part of our job, and what I probably hate the most, is all the documentation, but I do realize how necessary and how important it is. So we have to document, again, all the obs down, all the feeds times. We have to sign in and out the express breast milk like we would medication, because of course you do not want to give the wrong milk to the wrong baby. We also have to document when baby's pooing, when baby's weeing, if baby's vomiting, as well as assessing for pressure injury and just general observations of the baby. So it is a lot of documentation and it can be tricky to stay on top of it at times. But it is all very important because every little piece of information in these babies' early lives are very important and can all change their care. Another big part of nursery, and what I love with midwifery and in the nursery is mothercrafting, helping the mothers look after their babies, helping with breastfeeding, expressing, giving advice about safe sleeping or car seats or jaundice or cord care. I just absolutely love all that, and I feel like every and any opportunity you can take for education, you need to take it, because mothers can't get enough of it. They can be sleep deprived, and so just because they've heard something once doesn't mean, you know, it's gone through. So I love to just always talk to mums about their babies and tell them everything I can to possibly prepare them for the outside world. Another thing about the nursery that I think is a little bit different to midwifery is that you very much are working under a pediatrician and you're following their plan. Of course, in everyday midwifery, the antenatal clinic or in the birth unit, a lot of those decisions are made with you and senior midwives, team leaders. It's very midwifery focused and the midwives make a lot of decisions. But of course with babies, it is a very specialized area. You're very much working under the pediatricians, which I think is a great safety net, and I've learned a lot about the pediatricians. But of course can be interesting at times, which I'm sure as you all go through your midwifery career, you know there are a lot of different opinions on things like GBS and when to give antibiotics, when to admit baby to a nursery, when not to. As new evidence emerges, there's a lot of new things to follow, so it can be a bit tricky at times. So my current goal in the nursery is to get my corn assessment. It used to be called Dawn, but essentially it's called the Comprehensive Assessment of the Well Neonate. So generally what happens before a baby leaves the hospital is a pediatrician will check the baby. However, something's come in now where if it is a healthy baby with no risk factors, a midwife is able to check that baby and be able to discharge that baby. So because I have dreams and goals of working in a caseload model of care and I want to be as independent as possible in my practice, that is something I'm working towards, and I am definitely learning a lot. So I'm definitely going to be posting some notes and some insights on my Instagram as I go through that, so keep a lookout for that. So that about sums up the life in the nursery. Yes, I may have missed some things and you might find your nursery works completely different, but I hope it gives you some sort of idea of what life might be like in special care. Generally, the philosophy of midwife is to look after the well baby and we deal with normal. But I do think it is a great advantage to working with sick neonates, or what outside of normal looks like, so that we are able to identify and refer as needed. I want to thank you guys for watching again. You guys absolutely inspire me every day. I love following you on Instagram and seeing what you guys are up to, and I love when you send me messages. So thank you so much for following me along my personal journey, and I hope to continue to update you and continue to put out videos that are of use to you. So if you have any suggestions or anything you need or would like to see, let me know and I'll get to making it. Thanks for watching, and I'll see you next time.